It's Reverend Father Justin.
Political outing. This is a humanitarian service by our brothers and sisters in America. One thing that is very significant is that the program is well received by our people, and the turnout is very impressive. And we want to thank Almighty God for that. And I urge all of us not to allow us to be swallowed by anxiety. That is not necessary. So I want to thank particularly the organizing team, the people that coordinated this program, and working with the Commissioner for Health. And also pray for our people, brothers and sisters who are here to be treated. And then ask God to give the required wisdom to the doctors and the nurses, so that our people will be treated. It's not only today, they are here tomorrow, they are here next tomorrow, they help till the end of the week. So the patient, if you are not seen today, you will be seen tomorrow or thereafter. And they will continue to plead with them. Next year they will come in a larger number. And our people will also enjoy the benefit. This is part of our design we designed the program to support Medicare in our place. As we strengthen the local team with the visiting team, we do hope that quality Medicare will be made available by the government. My visit today is very important and good. At least we have seen the status of the hospital, and we have also identified areas that require quick intervention. We will intervene and make sure this place is really a specialist hospital, both in the outlook and in the services. So, let's thank all of us and write and crave your intelligence to reduce our bureaucracy so we can go face other things. So I want you to go back to work so that we don't spend the time that they will use to treat more people. They will know.
You're welcome to Imo State's Free Med Commission, organized by the state and collaborated with the Association of Nigerian Physicians in America. We have surgeries and medical cases to be seen. We have a participation by the federal, state, and private sectors vis-a-vis the Federal University Teaching Hospital Owerri, former FMC, the Imo State Specialist Hospital, Owerri, and regions. With me, you have on my right, you have the president of the Association of Nigerian Physicians in America, who led the team from the diaspora to this place. You have the executive secretary of the Imo State Primary Healthcare Development Agency. And you have the Honorable Commissioner for Health Insurance, who is also leading the obstetrics and gynecology team. So you're all welcome to this, and I'm sure you must have seen the turnout of all the patients that have come. More people are still coming, and we expect a very good turnout. Thank you. What is to give back to the indigents what we have gotten from the society. We need to help those who cannot afford most of these surgeries, and that is why we are here to do these surgeries this period.
Okay, sir. So for how many people registered?
We have over 500 surgical cases. We have well over 1,000 medical cases coming in, and it's open to the medical cases because it's a walk-in case arrangement for the medical cases. So we're going to get well over 2,000. That's what we're aiming at.
How far is the involvement of the state government to this medical, like 50, 50, 70, 100?
Pardon?
How long will it take?
The involvement of the state government is the total backbone of this medical mission. The total backbone of this medical mission is the Imo State government, and it is going to last till Friday this week. That's on the 3rd of February 2023.
Thank you.
We need to talk to them, talk to all these people. That's what we're doing.
May we know you, ma'am?
Hi, my name is Chinyere Nyago, and I'm the president of the Association of Nigerian Physicians in the Americas.
What's the objective of this program, and what is your impression about the turnout of the first day today?
I think the turnout has been excellent. The vision of the organization is a healthier Nigeria and a healthier world, and we're very pleased to be able to assist in any outreach and opportunity to take care of people who don't have the ability to pay.
Do you have enough facilities in place to conduct the surgeries?
I think this is an opportunity for all of us, including our physicians here and those who came from the diaspora, to collaboratively be able to take care of patients in the environments that they live in.
Have you been received well by the state government?
Yes, we have been very hospitable guests. Your Honorable Commissioner has been a great leader for the opportunity with the providers, and we've been very well received by the Imo State government.
Thank you.
I'm Dr. Bati Okorochukwu, Commissioner for Health Insurance. I'm leading the Ops and Gynae team with respect to this medical mission. I'll be covering that of Federal Medical, the Federal University Teaching Hospital, Owerri. So I've come here to ensure that we'll start the medical aspects, the surgical aspects in this theater. And the first case has just gone in. So I will now be moving. The other team is also waiting at Futo. And I believe that hopefully, all things being able, we'll be able to handle 112 cases that is booked for Ops and Gynae. Majority of them are just benign tumors of the abdomen, fibroids, then intravaginal growths. And then some of them will also benefit from hysterectomies. So we have all these teams ready, and everything is set for us to do this. And it's something that we really have to thank the Imo State government for also taking this privileged condition to help the indigent in the society. Because some of all these patients have had this thing for more than 4 years, and they don't have money to actually carry out the surgeries. Many of them are bleeding so badly. Some we will have to transfuse before we get them ready for this particular stage, so that they'll be fit for this surgery. And all the cases we are going to take are those that are fit. Many of them are medical certified, so that we don't have any problem.
And there are some illnesses that could not be treated.
Well, if we have conditions that we feel that there are multiple medical conditions that cannot be handled with respect to the surgeries, of course we'll cancel those ones.
Is this window still open for those who may want to register to participate?
You mean now? No, you know, for surgical cases, you need to prepare them. If you don't prepare them, the chances for you to have complications and morbidities are higher. So the ones we are going to take now are the ones we prepare. This is going to be an ongoing thing. After some periods again, there's also going to be a free medical, because that's one of the visions of His Excellency, to ensure that some of the indigent ones have free medical services in the states.
Okay.
All right.
Thank you.
My name is Reverend Sister Dr. Maria Yohanes Zoma, the Executive Secretary of Primary Healthcare Development Agency.
What is actually happening?
We are conducting this free medical and free surgical for patients, the citizens of Imo State. And thank you to the Imo State government who invited the American physicians to come in and do this. From the primary health health center's point of view, we recruited them scattered in various LGAs. So it is there that we mobilized patients. We recorded about more than 2,000 patients, medical, and then more than 500 cases for surgical. So we are hoping to reach many of them. We may not be able to reach all of them, but we are hoping to reach a very good number today.
What process do you take to select the beneficiary?
Anybody that comes in, we are targeting indigent citizens of Imo State. Anybody that walks in, presents herself or himself, somebody who cannot afford this surgical care. The person is...
You mean as the process is still ongoing now, anyone can register?
But not for surgical. You know, as Dr. Korochukwu said, you know, surgical, you have to prepare them to avoid complications. But for medical, they can just come in today and they will be seen.
Are the rural areas part of beneficiaries?
Yes, we recruited our patients from the rural areas. That's what I said, from the local government of Imo State. That's where our staff from the health centers and the local government area, they recruited our patients and they are all invited to this place, an FMC and Regions Hospital where the surgeries will take place.
Is it going to be an annual?
It's going to be an annual thing by God's grace. Maybe twice in a year, who knows? You know, as the governor finds suitable. You know, this one is very interested and he is very keen to continue the program. So hopefully we might have it again before the year also. Okay, thank you.
Antonia Ijomu Oduzie from Olu, married in Mbieri, Ashimbiri, Mbitoli local government area of Imo State.
What are you doing, Noreba?
Governor provide free medical treatment. So him General today.
Okay. Lego ga hota. Okay, how choputra?
Fibroid disease.
Okay, how go lagi?
We are about to enter for the theater for surgery program.
Okay, here we etonanya gi na emecha una ihe agara from.
Etonanya mba kemgbe aga m enye Chineke ekele. Onye mere ka m nwee opportunity iji banye na this particular program. Then ihe tụnanya ahụ ekpere m ụkwanụ ka Chineke mee ebere ka ihe niile gaa ọfụma. Na-ekelekwanụ gọvanọ onye nke wepụtara onye ohere ime ka ihe ndị a bụrụ ihe ga-adị ire n'ụbọchị taa.
Thank you. Okay.
I'm Dr. Emelife Charmaine Emelife. I'm an internist nephrologist, a specialist nephrologist, practicing in Atlanta, Georgia. I'm here for the Imo Medical Mission in collaboration with the Association of Nigerian Physicians in the Americas. I'm a past president of the Association of Nigerian Physicians in the Americas, and I'm happy to be here today.
Okay, ma'am, what's your feeling about the involvement in collaboration with the state government and the...
It's actually been a very great experience seeing how the governor has embraced this idea of free medical services to the people and working with the commissioner who's all in and fully involved in the intricacies, all the details of it, and the logistics personnel, Mrs. Akeji and Dr. Bola Adigun. It's been a fantastic experience. The welcoming and the reception and the appreciation and I mean, this is just beginning the process, is really telling of their passion to help and provide care to the people. I'm very impressed and encouraged, and hopefully we plan to be back here again soon, because I see that there's a high interest in helping the people, and we do that. That's what the Association of Nigerian Physicians in the Americas is all about. Working either through the organization or working with our own private foundation. So we're very, very happy and really glad to be able to help these people here.
Ụmụaka agụ ime mba nọ. Olee ihe butere gị ebe a? Ha elele gị ahụ? Olee ihe ọzọ ha chọrọ ime gị ugbu a? Kedu ihe wee bụ n'obi gị ma ọ bụrụ na emechaa ya aga nke ọma?
Foundation.
Agwala gị onye haziri ya, onye mere ka inye ọgwụgwọ n'efu aga. Agwa gị na ọ bụ gọvanọ Imo steeti. Hope Uzodimma. So ka ihe ị ga-agwa ya n'obi gị, kedu ụdị ekele ị ga-ekele gọvanọ?
Dịka anyị ndị ọrịa anyị ahụ n'ọtụtụ ibe anyị ndị ọrịa, ya biko gbaa mbọ ka o nwee ike na-eme ọ dịka ha n'ihi na ọ dịghị mfe mana iji ụlọ ọgbachi enyeghị free treatment ọjịshi ike chukwu gwara anyị onye chere n'ụlọ chere ndị ahụghị ahụ ụzọ ọ dịka anyị na-amụ emesịa ya taa bụ ihe dị ise na Chineke aka.
Sodia Ali, Chijoke Ifeyinwa, Jen Onyekwe, Ebugo Lovett, and
Sir,